We'll just start with perhaps you telling me, your credentials and your area of specialty.
My name is Edom, and I am an internist from Ethiopia. I completed both my undergraduate medical training and my internal medicine residency at Dilla University, at the College of Health Sciences there. And now currently I am working as an assistant professor of internal medicine at Dilla University in the southern part of Ethiopia.
As a practitioner, I know you're very familiar with continuing medical education, continuing professional development. Why do you think CME CPD is important?
Healthcare professionals work in an environment where there is newly emerging data continuously. So they need to update their knowledge and also their clinical skills in order to provide quality care for their patients. And so to improve the service that they provide, they need they need ongoing improvement in their knowledge base, and that would also help in their career development as well. That is what I believe about the CMEs and the CPDs.
And in terms of patient care, what would be the consequence if healthcare professionals don't keep up with maintaining the CME CPD?
That would cause that would bring about a gap in their awareness about the most recent recommendations with regards to diagnostic procedures, treatment modalities, and also additional ethical dilemma in solving ethical dilemmas and so on. So if they are not updated in those areas, then that would cause unnecessary costs to the patient. It might cause prolonged hospital stays, and it might also cause complications with regards to the treatment or the diagnostic procedures. So then they're having an updated knowledge base would be important to prevent these problems from arising.
Yes, I completely agree. I've spoken to a few healthcare professionals practicing in Africa, and the consistent feedback I get is that access sometimes is challenging. I'd like to hear from you. Is that what you also experience? And if so, can you talk about some of those challenges that do exist?
I believe that accessibility to CMEs might be a problem for many practicing healthcare professionals who are not working in an academic environment specifically. So most the problems that I have noticed are, one is with accessing these materials, CME materials. Well, maybe a partial solution in our country. There are some professional organizations that accredit this CMEs, and they also facilitate for their members to get free courses, either online, or they might prepare an in-person meeting. So being a member of those organizations kind of solves a problem, but access is a major problem, specifically for those who practice outside of the major towns. And the other is with regard to time. Most CMEs are organized on working hours, like for the locally produced CMEs. And if a person has to attend online courses, there might be a time difference with unless it's a pre-recorded course, then the time is also a problem. And with regard to cost, well, I think the affordability of some of the courses for those that we have to pay might be an issue. And also here I'm also speaking from a perspective of people in our country. There might be a difficulty of performing the payments, processing the payments, even if they wanted to attend a paid CME. So I think those are the major issues. But maybe by becoming a member of the professional organization, some of the problems might be alleviated about accessibility. But still, I think there is a large issue large gap.
Now, for those that are not part of a professional organization, is it such that the problem is even magnified in that they do not have access?
Yes.
A lot of the work that Milo Initiative is doing is online courses, making it available literally to anyone who has access to a computer and the internet. Do you think that might be a solution, especially to those who are not part of a professional organization?
Yes, I think it would help because if the courses are pre-recorded and if the people who are not members of professional organizations can have an access to an internet to at least download a part of the course material, and I think people can keep up with that. I think it's a good method of delivering the CMEs.
You have been involved in developing the Milo Initiative courses. I want to hear from you overall. Does anything stand out to you about the course content that you have been involved in developing?
The courses that I've participated in, what stood out to me was that there was a huge effort to try to bring local treatment guidelines and practices into the course materials. So that is very important because there is a resource limitation in most of our setups, and we can't directly implement guidelines from American and European countries. So I think that is very important, including the local treatment guidelines. And the courses were prepared in a clear format, and I found them very helpful.
As far as working with the Milo Initiative team, what was your experience? I'm asking this because my hope is to bring on more subject matter experts to help develop even more courses. So can you speak about your experience working with the Milo Initiative team?
Okay, so far I've only interacted with you, and my experience has been positive, and I like that you provide the course materials and you give prompt reply whenever I try to reach out, and it has been positive in general.
That's good. Thank you for that endorsement. Yes, while I'm the face of the Milo Initiative, there is a whole team behind me. So, and I suppose how I interact also reflects on how the rest of the team interact. So, so thank you for that, those comments. Now, would you recommend the Milo Initiative courses to a healthcare professional in your country?
Yes, I would.